Welcome to the Birth Boot Camp podcast, your trusted guide on your journey through pregnancy, birth, and beyond. I'm Holly, your host, along with Cheryl, Megan, and Liana that make up the Birth Boot Camp headquarters team. Together we are here to explore the amazing world of childbirth and family wellness. Each week we'll dive into empowering conversations with expert guests and share practical insights and heartfelt stories to support you on your unique path to parenthood. Whether you're expecting your first baby, you're a seasoned doula or childbirth educator, or simply curious about the miracle of birth, you're in the right place. Together, we'll celebrate the beauty of birth, honor the strength of motherhood, and embrace the joy of new beginnings. So sit back, relax, and join us on the Birth Boot Camp podcast, where every birth is amazing, every family is supported, and every story matters.
Hello, and welcome to the Birth Boot Camp podcast. I'm Megan Busk, the head of marketing.
And I'm Liana Wolf, the administrator.
And today we are super excited to have Ali Lowe with us, and we are going to discuss a really important topic, especially for birth workers and people who are helping to support others, and that is trauma-informed care. And Ali has some great tips and advice for us today. And can you go ahead and just tell us a little bit about yourself, kind of where you're from, what you do, and all those things?
Hi, everyone. My name is Ali. I'm from San Jose, California. I got into birth work back in 2017 when I became a birth boot camp doula. I was still in college and brand new to birth work, and that led me on a journey to labor and delivery nursing, forensic nursing, and now I'm a student midwife at Georgetown, which is exciting, and I graduate in August. So I am ready for school to be over, but excited to be on another side of birth work. But I still do doula work, mostly for my best friends, but it's a great area of work. And I've been a nurse for about 2 years now, and where my trauma-informed care background really comes in is through nursing, and then pairing my love of birth work with forensic nursing.
Awesome. That's amazing. What a cool path that you're on.
Yeah, it's exciting. I'm a little nervous to be here, but excited to share all of the important aspects of trauma-informed care and how those of us in birth work can really help bridge this gap that we often see in obstetrics.
Yeah, absolutely.
Absolutely. I got to say, your background's a little intimidating. You have done so much, and it's so cool, like Megan said, to see the path that you've been on. Let's start with just a very basic definition of trauma. Different kinds of trauma and what those can stem from.
So trauma really is, I like to think of it as this big umbrella term that is all-encompassing. It permeates through societies, across cultures. It really knows no bounds. And there's such a wide variety of types of trauma. When I did this research presentation for school, what I specifically was looking at, which is what's available in the literature, but it's definitely not limited to these, is adverse childhood experiences, or ACEs, and then sexual assault and violence, and domestic violence or intimate partner violence. And sexual assault is really any form of violence against a person with a sexual nature, whether it's comments, touching, extending all the way towards rape. So it's kind of a broad definition, but really there's so much that plays into trauma that's really the whole aspect behind trauma-informed care, is that it doesn't really recognize the barrier or the bounds of one specific definition. If that makes sense.
Yeah, no, that was wonderful. That was wonderfully put and explained. Can you give us like some signs or symptoms that people may exhibit after going through trauma?
Mm-hmm. So I really like this question because a lot of people, when they interact with, whether it's a doula interacting with a client, or whether it's a midwife interacting with a client, or an OBGYN interacting with their patient, there's a lot of the ways people may present with differing types of anxiety or depression can really be one of our indicators there, as well as thoughts that are obsessive or really interrupting sleep, anything like that that's interfering with your ability to partake in activities of daily living, or your social intimate relationships, your relationships with peers, or ability to participate in social activities. It can also come in terms of post-traumatic stress disorder, having those flashbacks or triggering episodes that wake you up at night in a cold sweat because you were just brought back into that trauma state. It can also come into play when, and I see this a lot in my work as a forensic nurse, when we're conducting an interview or asking them about what they experienced, certain details can be very difficult to remember. And that really comes into play with the neurobiology of trauma. And it does really impact your memory because you're in that fight or flight state. So those are some of the examples. But one of the other things that I think it's overlooked a lot is that trauma, especially with trauma that occurred in childhood, such as adverse childhood experiences, can really lead to higher levels of lifetime chronic stress. And we really, in medicine, we do really see this a lot in things like your CRP level and higher blood pressure, diabetes. It sets you up for increased risk for all of these other lifetime complications.
Wow, just to see that, like, something from childhood and how much it can carry with you throughout your life, and not just mentally, but like those symptoms that you're saying are all physical. Like those are
Mm-hmm.
things that you wouldn't normally, like diabetes, you said, wouldn't, you don't normally associate with trauma, but that's really interesting to see that correlation.
Oh my God. Just I'm that was so much. And like I knew, I knew intellectually before you said all of that, we've all heard of, it's the name of a book, The Body Keeps the Score, and the idea of
Mm-hmm.
how that trauma can affect us physically. But the way you just laid that all out is just, it can be really overwhelming to see just how much even things that we don't think of as small or as large, like small things that happen, but they can really like bog your body down. And
Mm-hmm.
wow, that is crazy.
Yeah.
I want us to lean a little bit more towards pregnancy and birth now. Can you identify the antepartum complications that are associated with the history of trauma?
So there's a lot. And when I did my research for this, I was surprised by some of these, although now look, hindsight's 2020. So looking back, I'm thinking to myself, I really shouldn't have been surprised given the physiology and extra stress that pregnancy does have on the body. But how we see trauma impact a pregnant person are higher levels of chronic stress, PTSD, miscarriage. And then when we get into the intrapartum complications, which stem from us beginning an antepartum, we see preterm birth, low birth weight. And then there were 2 studies that pointed towards a potential to impact rates of placental abruption and a premature rupture of membranes. But I have a little mental asterisk there because it said there's a correlation, but we can't quite definitively reach that stance at this point. So there is more research needed for rates of placental abruption and premature rupture of membranes.
Wow, thank you for sharing that. It just shows that there's so many things that can occur from the trauma, and things to kind of be aware of and keep an eye out for, especially as like birth workers. Um, what what kind of impact does the history of sexual assault have on somebody who is giving birth?
A lot, so much. We could have a whole discussion just on this,
I'm
but
sure, yeah.
definitely we see a lot impacting when we actually are seeing these clients labor and give birth, because just of the sheer nature of pregnancy and childbirth, it's so intimate. You
Mhm.
have this entire focus on an area that, for a lot of people, not everybody, for a lot of people with this type of trauma, it's associated with their memories and experiences of living through that trauma. I myself am a survivor of sexual assault, and I know that I have not had a child yet, hopefully soon, but I know that for myself, gynecology appointments are very difficult. And, when I worked as a birth doula, I specialized in working with survivors of sexual assault, human trafficking, and past trauma. And it was very interesting. I would probably see 50% of my clients wanting an epidural so that they would have no association of pain in that area, and then the other half would want to be fully aware of everything they're feeling and sensing in that area, so that they have that full breadth of knowledge about what's going on with this area of their body that was where their autonomy was taken away from them. So it's very interesting to see those two approaches to pain management during labor. And other things that I will see are what I affectionately call emotional dystocia, where we have this high stress, high triggering environment, and all of the focus is back on the genitals, that area that's associated with that trauma. And sometimes what can happen is they really tense up and go inward, and it can cause some episodes of triggering during labor. And really what is important to remember in that situation is that you're really just there to support them, which we all do as doulas. And sometimes that just involves telling them it's okay to cry, scream, whatever they need to do to release those emotions that they're holding on to and what is triggering them in that moment. And there's a lot I could go on to say, but I'll leave it at that for now.
Well, I'm going to have you say more, because
Okay.
So you you said you have specialized kind of in supporting people who have had trauma in birth, and I think that is absolutely so important. So I want to learn more about what trauma-informed care is. What does that look like? You touched on it a little bit, but I really want to get more information on what that even means for those of us who are doulas.
So when I talk about trauma-informed care, I like to start with kind of a broader approach to it. So it's basically this idea that you keep in the back of your mind that anybody you're interacting with could have experienced trauma at some point in their life, and that this is going to impact or has the potential to impact nearly every facet of their life. So with that in mind, you kind of keep this in the back of your head every time you're interacting with somebody, because not everybody is going to feel comfortable disclosing this to you. And that's really one of the big aspects of trauma-informed care. One of the studies I actually looked at talked about, or it was an interview with pregnant teenagers who were survivors of trauma. And the majority of them, over 50%, said that they would prefer their provider to screen them for a history of trauma after the second or third visit, where those first one or two visits, they're building a rapport with the provider, they're learning about them, they're building this relationship and feeling more comfortable to then later be okay sharing this when the screening questions do come up. So keeping in mind that not everybody out there with a history of trauma is going to feel comfortable sharing it with you, because they're just meeting you typically for the first or second time. So this may not be something that as a doula, your client even mentions to you. Maybe you see some signs such as a lot of anxiety when it comes to pelvic exams, or kind of crawling away from the provider, which is a very normal response even for people without trauma, because it's a very vulnerable thing to experience. So little things like that, or not wanting any male providers, that's a common one I see. That's one, I'm sorry to all the male providers out there, but that's one that I will for myself do. I can't quite get there yet. But those are very normal responses for people who've had a history of trauma. And then it really also emphasizes client safety and preventing re-traumatization. So those are some of the big key points behind trauma-informed care. And then there's this other aspect of trauma-informed care called the 4 R's. And it's realize, recognize, respond, and resist re-traumatization. So with realizing, you're understanding the impact of trauma, you understand the statistics of it and how prevalent it is worldwide and within the US. And then you're recognizing the signs and symptoms of the trauma history. For respond, you're responding to that prevalence of trauma by forming policies that reflect this model of care, or personally checking yourself at the door and any biases you may have, or taking that step to take trauma-informed care training. And then resist re-traumatization is how it sounds. You're actually implementing the methods of trauma-informed care to be able to prevent any potential for re-traumatization. And I could continue with the specifics of that if that would be helpful.
Yeah, do it. We want to hear and know all the things.
And
one of
I just want to say something that you said that I really want to reiterate, and something that I think is easy to forget, is that we need to assume that our client has had trauma.
Mhm.
And so there's an element to that care that all of us need to have, just because we don't know. And sometimes they'll never be comfortable sharing with us. So I'm really glad you pointed that out, because it's easy to forget.
It definitely is, especially when you yourself are coming from a place where you haven't experienced this type of trauma. It can be hard because you can't really remember it, how much it affects everything if you haven't been there. But that's where trauma-informed care training comes in to kind of fill that gap. One of my favorite resources that I found when I was doing this literature review is Lo Giudice et al. From 2023. And one of the co-authors of this paper is Stephanie Tillman, who runs Feminist Midwife. And she's got wonderful resources for providers in their language when it comes to gynecologic care. And this is one of my favorite examples to give when it comes to trauma-informed care, because it's such a simple thing that providers can adapt to improve their trauma-informed care training. And really, these phrases should never be used, but people do them. So this is where it comes into play, that you're going to check yourself. Have I said this before? How can I change my wording? Do I need to practice this in a mirror? So some of the phrases to avoid, and I'm sure we've all heard this at the doctor's as well, or your provider's office. Well, especially with cervical exams, I'm sure we've heard providers say this to our clients as well. So the classic one, spread your legs, which gives me the biggest ick. I get a visceral reaction to that. So imagine how our client, who's already in this vulnerable state, is going to feel when they're told this phrase that could also be a phrase that they have heard during their trauma. And then, so instead of that phrase, or open your legs, or just relax, which are all very triggering in them of themselves, but I'm sure we've all heard them before. What I like to use, and what I hear a lot of providers now using, are go ahead and put your legs in butterfly position whenever you're ready, or let your knees fall to the side. You're in control of this exam. If you say stop, I'll stop. If you say out, I'll remove my hand / speculum, whatever the exam is. So adjusting our terminology and phrasing is so helpful, and it's so crucial, and it's so simple. So this is something that's very easily adapted into your everyday practice. Or for those of us who are attending births or maybe prenatal appointments with our clients, and we hear some of those phrases, we can maybe pull that provider out to the side and say, hey, I noticed you use this phrase. I would recommend using this in the future. Those phrases can be triggering for X, Y, and Z reason. And that's really one of the big examples I like to use. And then the other one I like to use that is so simple and is so important is just simply asking permission before touching somebody. This one I have a hard time with myself. Even when it's coming from a place where I know the person and I know it's just for a kind reason, where they might touch my shoulder, but I'm not facing them, so I don't know who it is. I still to this day will jump a little bit because it's triggering to me. And when we think about our clients who, again, are in this vulnerable state, potentially feeling feelings that are associated with their history of trauma, or hearing these phrases, if somebody comes up behind them when they're laboring and feeling, again, that vulnerable state, and they touch them without asking, and again, this isn't everybody, but for some people with trauma, that can be very triggering. So simply just asking people, is it okay if I touch you? Or, when they're laboring, a lot of people do not want to respond to you in that moment. So this could be a conversation that you have prenatally, or if it's an induction when everything's getting started and we've got that kind of chill phase where they're able to respond, or in earlier latent labor, asking. So I know even if they don't have a history of trauma, just having this in your practice where you're having this conversation, asking, during labor, I might recommend certain comfort measures to help with your back pain or labor pain. Would it be okay if I place my hand on your low back or your sacrum and provide counter pressure? And they might say, sure, that's fine, or let's talk about it in the moment. So just opening that up really gives the onus of control back to the client, because this is their body. And just in these simple acts, you're preserving their autonomy. You're acknowledging that this is their body, this is their experience, these are their choices. And even though it might seem so simple, it goes a long way.
I love those examples because they are simple things that we can implement and recognize. I feel like just you saying that, I'm like, oh, I do remember, you know, those phrases being used to me as I've gone to the, you know, through the process of doctor's visits and things like that. So just being able to be aware. And I think it all stems back from like our earlier discussion about just kind of assuming that, like, because sexual assault and trauma and all these things are so common, that we can really just always, you know, apply these, because we just never know. So if we're always taking the initiative and just assuming that, you know, there may be past trauma, then we can be better birth providers and be able to offer the best support. So I think just realizing that and realizing that there are small changes that we can make to make a better experience is so key. So those are wonderful examples. Thank you so much.
Yeah, and thank you for mentioning even your personal experience of just having somebody touch your shoulder when you don't see them. Because it seems like it shouldn't be a big deal. But it can be. And it, as doulas, it's really easy to walk in and be like, great, I already have a relationship. And, you know, and you want to assume consent, that they know you're going to be physically helping them. And it can be hard to forget, but we're in a different frame of mind now, and we're in a different state, a vulnerable state, and that permission can be revoked at any time, and you should be listening to that and asking ahead of time. So I'm glad you mentioned that, because yeah, it's so easy to just get into your mode of your job and forget that they can change their mind at any time, and to be prepared for that.
Absolutely.
Yeah, exactly. And really just checking along the way, you know, if you're seeing certain reactions, being aware of what their body is doing. Maybe if you do place an arm on their shoulder or their back and they're kind of jolting a little bit, you know, like that could just be simply out of surprise. Maybe they didn't know you were there. However, it could also be because they're like, who is touching me right now? Because I didn't know anyone was going to touch me, or I don't want anyone to touch me right now. There's so many reasons why, but exactly, really just assessing the situation, having those conversations in the beginning when they're not in labor or when they're in early labor, so you can come up with a game plan together of how they want to approach it. Do they want you to say, is it okay if I touch your arm, and they just give you a nod? Or say, yeah, you can go ahead and do the comfort measures. I'll let you know if I don't want that right now. So really just setting up what the expectations are, what the goals are, and what they feel comfortable and don't feel comfortable with.
Do you have any additional tips that birth workers or care providers, doulas, anyone can use when helping people with trauma?
Yeah, so I think having these conversations is so helpful, especially for people who haven't experienced trauma or haven't worked with trauma survivors before, which I'm sure most people have. But again, we don't always know when someone's experienced that because they may not feel comfortable sharing it. But having these conversations, and if this is brand new to you, having these conversations, doing that extra work, whether it's reading something like Body Keeps the Score, which is a wonderful book, and I do love it. I tell everybody to read it who's not super familiar with trauma. And going to trauma-informed care trainings. I know at where I work, we had to do it last year, I believe, and some provider offices and bigger practices are implementing trauma-informed care training into their work. So that is incredibly crucial. And I'm forgetting her name, but I can send it to you guys. She does specifically trauma-informed care training within the nursing field. So trainings that are specific to that can be very helpful. But on top of that, I think at the end of the day, if you just adopt that assumption that anybody you interact with could potentially have experienced trauma at some point, you're making that first step. And then from there, acknowledging we're all human, we all make mistakes, but I would recommend thinking back on your practice and your interactions with clients before and thinking, have I done XYZ? Have I assumed it was okay to touch someone without asking? And for some people, that is not a big deal, but for others, it is. So keeping that in mind. And then going back to your own experiences within, whether it's your own birth or your own experience at gynecology appointments or any healthcare appointments, really, because being a patient is so vulnerable. So looking at your own experiences, and if you are a survivor, even if you aren't, have I heard someone say XYZ? Like, have I heard someone say, just relax, it's going to be over quickly, spread your legs, drop your knees, or anything that ends in for me, which is super triggering, like drop your knees for me, spread your legs for me. Those are incredibly vulnerable phrases and potentially re-triggering and re-traumatizing for people. So if you've experienced that, thinking back, how could this have been worded differently to make the exam or whatever it is feel more comfortable to me? How could someone have done something differently that would allow me to feel more in control of what's going on, because this is my body. So even just that simple for providers or doulas, however you're interacting with a patient when it comes to contact with their body, just simply saying, you're in control of this experience. This is your body. If you tell me to stop, I'm going to stop. You are in control. Just simply reiterating that, reinforcing that can be incredibly empowering and helpful for our clients.
Awesome. Thank you so much. This has been so enlightening, and I'm so grateful for your research and for all the things that you've shared with us today. Can you tell us a little bit about where we can find you, like your website, social media, anything like that?
So I got off Instagram for a while, but
That's fine.
I recently
Sometimes that's
started.
needed.
Exactly. Yeah. I recently started using it again. So I need to double check. This is silly. I need to double check my username because it slips out of my mind. But my Instagram is Alexandra Rose, which is my middle name, G Low or Glow, Gruber Low, married and maiden name. And then my website's under construction right now, but it's around the bay, birthandbreastfeeding.com. So I'm still working on that, but it's not up and running right now. But I did write an article for that website, which I have shared to my LinkedIn, which is 10 tips for survivors giving birth. So if you want to access that for your clients, you can feel free to email me. If you guys want to share my email, that's totally fine. But it is available for access right now under my LinkedIn, since it's under construction on my website. But my LinkedIn is Alexandra, and then in parentheses, Gruber, my maiden name, and my last name, Low. But we can also link that. Can we link that to the
Yes, absolutely.
podcast?
We'll get all that from you, and we will include it in the
Perfect.
comments down below for sure.
Sounds good. So that's my social media right now. I do have a TikTok, but it's mostly about my upcoming book. So I don't know if it would be very helpful.
Well, do you want to share with us a little snippet about your upcoming book?
Sure. So I am writing a book that basically retells Selkie folklore, which is a Celtic and Scottish folklore origin story. And if anyone's not familiar, a Selkie, this is taking a whole 180 from trauma. But A selkie is basically a shape shifter or part of the fairy realm where they are a seal in the land, can shed their skin and become a human, or a seal in the water, I'm sorry, and shed their skin and become a human on land. And so I'm retelling that folklore with a feminist and female empowerment perspective. And it's a dual fantasy POV novel where I also explore aspects of modern day healthcare, specifically women's chronic pain. So I know that sounds super weird and you're not quite sure, you might be not quite sure how those two connect, but they do connect, I promise.
We believe you for sure. And we can we can include a link for that as well.
Yeah.
Wonderful. It's been so wonderful to speak with you today, Allie. We really appreciate your time, and make sure to subscribe and follow us for more podcasts in the future.